Hello everyone, myself Dr. Trishna S.Baruah, presently working as assistant professor in Assam Downtown University. Today I am going to discuss about positioning for stroke people. So what is stroke? According to American Stroke Association, it is said that a stroke occurs when a blood vessels that carries oxygen and nutrients to the brain is either blocked by a clot or burst. When that occurs or when it happens, the part of the brain cannot get enough blood supply and the brain cells dies. As we know that the brain is an extremely important complex organ of our body which controls various body function. So if stroke occurs and blood flow can't reach the region where it controls our various body functioning, that part of the body won't work. There are different types of stroke are there, like transient ischemic stroke, hemorrhagic stroke. This transient ischemic stroke is also known as a mini stroke. In this diagrammatic representation, we have seen there is one is blue color, one is a white color. So here in a blue color represents that in diagrammatic view, we know that when right side of our brain is affected, then left side of our body is affected. In the same pattern, if the left side of the brain is damaged or affected, then right side of our body get affected. So in this picture, this blue color denotes that the right side of the brain is affected. That's why there is paralysis occur in the left side of the body. In the same time, there is other complications, other associated problem like perceptual deficit, behavioral changes, and memory deficit. So this is positioning for person who have acute hemorrhagic stroke. As I have already mentioned, I'm going to discuss about 5 positioning for stroke patient. In the first picture, we can see that the patient isn't lying on left side. That is on the affected side. In this position, we can use this position if the patient doesn't have any associated problem. For example, if the patient doesn't have any breathing difficulties and all. So we can use 1 to 2 pillows for the head support, uh, protect the scapula of the affected side, then extend the wrist and fingers. Place the right leg forward on 1 to 2 pillows, right leg in the sense unaffected leg, and place pillows in front and behind the patient for support. In the second position, the patient lying on the right side, that means on the unaffected side. Here also we can use 1 to 2 pillows for head support. Then place the left shoulder forward, scapula protracted with arm supported on a pillow. That means affected side. Then left leg backwards on 1 to 2 pillows for support. Then place a pillow front and behind for support. Then next position is sitting up. This is a very important position. So in this position, we have to instruct the patient, or we have to support the patient to sit well back in the center of the chair or wheelchair. Then place the arms well forward. The left arm may rest on a table or armrest, that means the affected side. Then feet should be flat on the floor or footrest in case of wheelchair, and knees should be directly above the feet. Then fourth position, we can see that the patient is now lying on his back. So in this position also, if the patient have any associated problems like breathing problem or other complications, then we can modify these positions. So if there is, in this position also, head of the bed can be 0 to 30 degree unless any contraindications is present. We can use 3 pillows to support both the shoulders, both the affected and unaffected shoulders. Then left arm on a pillow, that means the affected arm should be on a pillow. Then optional pillow can be used beneath the left hip, that is on the affected hip. Then ensure that feet are in a neutral position. This is very important point when you make a position in a patient in a lying in supine lying, then we have to ensure that the feet should be in a neutral position. The last position is sitting in bed. So in this position also we have to instruct the patient, we have to support the patient that sit upright and well supported by pillows. Then place both the arms on the pillows and legs supported for comfort. So these are the 5 basics positioning of a stroke patients, that means hemiplegic stroke patients, that we have to maintain. Positioning of the patient is very much needed to prevent the pressure shock or any other complications. So as a physiotherapist, we should instruct the patients, we should assist the patient in a correct way. So this is all about the positioning of the patient. Thank you.